In this video, we will be talking about eating disorder called as anorexia nervosa. Anorexia nervosa is a DSM-5 diagnosis assigned to individuals who become preoccupied with maintaining a low body weight. A serious psychological disorder, anorexia nervosa is characterized by abnormal attitude towards food that affect the sufferer's behavior and eating habits, often with physical, psychological, and social consequences. If we talk about its prevalence and incidence, it's estimated it affects young women more often than men. Anorexia nervosa is diagnosed in approximately 0.4% of young females each year. The disorder also affects men, but less is known about the prevalence of anorexia nervosa among males. However, the condition is thought to affect women and men at a ratio of 10:1. If we talk about the causes of anorexia nervosa, then the exact cause is unknown, but some risk factors may play a role, such as genetics, neurochemical factors. In this, serotonin, norepinephrine, and dopamine dysfunction can account for anorexia nervosa. Environment, socio-cultural influence that project thinness as a desirable trait, and peer pressure which encourage associated behavior. Psychological factors which may include tendency towards depression and anxiety, difficulty in handling stress, excessive worrying and feeling scared or doubtful about the future, perfectionism, being very emotionally restrained, having feelings of obsession and compulsion, excessive figure consciousness. These all can account for anorexia nervosa. If we talk about the signs and symptoms of anorexia, then not eating enough food and over-conscious of physical appearance is the first sign of anorexia nervosa. The other symptoms include extreme weight loss, thin appearance, intense fear of gaining weight, abnormal blood count, fatigue, insomnia, dizziness or fainting, bluish discoloration of fingers, hair that thins, breaks or falls out, amenorrhea, dry or yellowish skin, intolerance of cold, irregular heart rhythm, low blood pressure, dehydration, osteoporosis, swelling of arms or legs. Now we will talk about diagnostic criteria for anorexia nervosa. For anorexia nervosa to be diagnosed, a number of criteria need to be met. There are 3 specific features that should be present in this disorder. The sufferer's weight is significantly low, less than the minimal normal or expected body mass, taking into account the individual's height and age. The sufferer displays an intense fear of gaining weight or becoming fat. This fear does not usually improve even when the individual loses weight. The sufferer displays a distorted view of their body weight and shape, either feeling overweight or feeling that some areas are being too fat. Now coming towards its management. Then a patient with anorexia nervosa can be treated by 2 ways: psychotherapy and medication. Apart from these 2, there should be nutritional counseling as well. In severe cases, the anorexia nervosa patient is hospitalized. In psychotherapy, individual therapy and family-based therapy is given. In individual therapy, cognitive behavioral therapy is given and family-based therapy is given to the family of teenagers who are suffering from anorexia nervosa. Medication of anxiety, depression and insomnia is given. Along with these medications, the medication for appetite is also given. In nutrition counseling, the plan aimed to re-establish healthy eating pattern is done. Hospitalization is done in case of severe weight loss due to starvation and dehydration. Sometimes the case of severe depression and suicidal thoughts or actions may also require hospitalization in these cases. Stay tuned with Nursing World and follow me on Instagram with the name of Nursing World 21. And if you are not yet a subscriber, please go and click on the subscriber button. Thank you.